All right, so for this video, we're going to be discussing the objective exam that includes subtalar joint neutral measurement. And first we have to ask, what is subtalar joint neutral and what is the subtalar joint? The subtalar joint, first and foremost, controls the degree of supination and pronation and is close conjunction with the transverse tarsal joint of the midfoot. Additionally, when we're looking at subtalar joint neutral, we're in essence measuring the amount of calcaneal or hindfoot inversion and eversion that is occurring. And with this, it's really an assessment of the non-weight-bearing hindfoot or rear foot as it relates to the leg, and then taking that measure or that angle. It's also a measurement of the forefoot to rear foot position, which you'll see in just a second as we're moving the forefoot on the rear foot in order to find that neutral position within the arc of motion. And why this matters is if you are casting for a specific or custom foot orthoses, ideally you would want to position them into their neutral resting position such that they are neither going into too much pronation or too much supination, but rather are kind of in that mid-range position. Additionally, for normal gait, individuals need about 4 to 6 degrees of eversion and about 8 to 12 degrees of inversion in order to not develop compensatory motions. The subtalar joint neutral then is the angle at which the ratio of calcaneal inversion to eversion is about 2 to 1. And if you've already watched our range of motion assessment, you know that that is about the average that most people have, sometimes as much as 3 to 1. Really, the clinical correlate here is that an individual that has excessive pronation could then lead to a compensatory motion higher up the kinematic chain, that being tibial internal rotation. What that can relate to, and keep in mind we're talking correlation, not causation, but what that can relate to then is an increase in terms of rotary stress and shear forces, specifically at the knee and at the patellofemoral joint. And so oftentimes that's where this discussion of subtalar joint neutral comes into play. Now we have to ask ourselves, is it a worthwhile measurement to take? And in most cases, the answer to that is no. There are select cases where taking this measurement and recording it are appropriate, for example, when casting for custom orthotics, but it's not without some debate. There's a great Viewpoint article that was published in JOSPT titled, "If It Doesn't Work, Why Do We Still Do It? The Continuing Use of Subtalar Joint Neutral Theory in the Face of Overpowering Critical Research." And if you're interested in a further in-depth discussion on that, I would encourage you to look at that. Paul Herradine is the author on that, and that was published in 2018 in JOSPT. For now, though, we're going to talk about how you would actually take this measurement as it relates to rear foot to leg and forefoot to rear foot. And so at this point, our patient is already in the position that we need them to be in, which is they're going to be laying prone with the foot extended over the end of the table. At that point, you're going to come in, you need 2 items, that being a goniometer and that being a pen. Before you start your measurement, the first thing you need to do is you need to make a line that bisects the calcaneus and the distal Achilles tendon. And so you can line that up, find the mid portion distally and proximally, measure twice if need be. And then you can use your goniometer as a straight edge such that you get a nice line. At this point then, you're going to use one hand to palpate the medial lateral aspect of the tailless, just distal to the talar curl joint. And you're going to use your opposite hand, in this case my left hand, to come just distal to the 5th metatarsal such that I can grab the 4th and 5th met heads. So at this point, it's going to be a little bit difficult for you to see my hand position, but I'm essentially using kind of a C grip to palpate and find both the medial and lateral aspect of the tailless. So I'm just down from the talar curl joint. I'm then going to find my 4th and 5th metatarsal heads, and I'm going to rotate the individual from a supinated position here to a pronated position here. And as I do that, I'm going to be able to feel the tailless both on the medial and lateral side. As I feel the tailless, what I want to be able to find is the spot or the point through that arc of motion where neither the lateral aspect of the talus or the medial aspect of the talus is prominent, essentially the middle ground, where both of them are about equidistance from my palpation. Once I find that, I'm going to pause in that position. I'm not going to move my left hand. My right hand comes up. I'm going to find my goniometer to take a measurement of this. My stationary arm bisects the soleus and distal Achilles. Axis of rotation is the subtalar joint, that being between the talus and calcaneus. And then my mobile arm is going to line up with my line that I made after bisecting the calcaneus and Achilles tendon. And what I find in this case is that there's about 4 degrees of inversion that's adopted in subtalar joint neutral. And so at this point, that would be essentially the hind foot on leg or rear foot to leg ratio. And somewhere around 2 to 3 degrees of inversion is considered normal. If we get above that, we start to say that perhaps we're dealing with some rear foot varus. However, rear foot valgus, which would be more of an everted position, is exceptionally rare. Very few individuals are in that position. If they get above about 5 degrees, then you can confidently say that this individual has more of that hind foot varus position. The forefoot to rear foot position, which you can visualize from the more vertical posture. Again, you can use your goniometer, you can place it at the med heads, and you can visualize how the forefoot then associates with the hind foot. In this case, the hind foot is in a slightly varus position or inward position, and the forefoot is also slightly inward. But when we look directly vertical, they're about perpendicular. And so in this case, we would consider that to be normal in terms of the hind foot to forefoot ratio. So hopefully that gives you a window into how to measure subtalar joint neutral. There is a measurement technique as well that can be done in a more weight-bearing position. And here we look at degrees of navicular drop as well. We're going to forego that at the current time, as reliability and accuracy of those measurements is very unreliable and skewed. For now, just work on this. Make sure you have a pen and a goniometer present. Have a go with a colleague or peer, and let me know if there's any questions.